If you are over 50, 60, or beyond, and you've noticed something unsettling during intimacy, this message is important. You still feel the full wave of pleasure, the unmistakable moment of climax, but there is little or no fluid released. Maybe it happened once and immediately sparked worry. Or maybe it has happened more than once and you've kept it to yourself, quietly wondering what it means for your health, your masculinity, or your future. First, take a breath. This change does not mean your manhood has disappeared, and it does not mean your intimate life is over. What you are experiencing is not a failure. It is a signal, and signals exist to be understood, not feared. When you understand what your body is telling you, anxiety fades and control returns. What follows is not meant to scare you. It's meant to give you clarity. In the next few minutes, you'll understand why this happens, when it matters, when it doesn't, and what can realistically be done. Knowledge here is power, and power restores confidence. To understand what's changing, it helps to know how things normally work. Think of the reproductive system as a coordinated sequence rather than a single action. Different glands contribute fluid, different muscles contract in rhythm, and nerves act as the conductor that times everything perfectly. When everything fires together, fluid moves forward and out at the moment of climax. Here's the key distinction many men were never taught. Climax and ejaculation are not the same process. Climax is a neurological event. It happens in the brain and nervous system and produces pleasure. Ejaculation is a mechanical event. It is the physical release of fluid. Most of the time, these two happen together, so they feel inseparable, but they are driven by different systems. Dry ejaculation occurs when pleasure is still present, but the fluid is not. Many men describe it as an empty orgasm, and that gap between expectation and reality can be deeply unsettling. What matters is this: your ability to feel pleasure can remain completely intact. The change is happening in the delivery system, not in your desire, identity, or worth. The most common reason this happens is something called backward flow. There is a small muscular valve at the opening of the bladder that normally closes tightly during climax, forcing fluid to exit the body. If that valve does not close firmly enough, the fluid takes the path of least resistance and flows backward into the bladder instead. When this happens, you still feel climax normally, but nothing comes out. A common clue is cloudy urine afterward because the fluid mixes with urine and exits later. This is not dangerous by itself, but it can be alarming if you don't know what's happening. This backward flow often appears after procedures involving the prostate or bladder, even when those procedures are successful. It can also occur as a side effect of certain medications used for blood pressure or urinary symptoms. The medication does its job, but it relaxes that tiny valve just enough to change the direction of flow. Another cause is blockage. In this case, the glands are producing fluid normally, but the small ducts that carry it are partially or fully obstructed. Think of it like a pipe that has narrowed over time. Production continues, but delivery slows or stops. Blockages can develop after past infections, chronic inflammation, or scarring that went unnoticed years earlier. Some men notice subtle warning signs, such as a gradual reduction in volume over time or mild pelvic discomfort during climax. The encouraging part is that many of these blockages can be treated once identified, often without major intervention. A third contributor, especially as men age, is nerve signaling changes. Conditions like long-standing diabetes, spinal issues, or pelvic nerve irritation can interfere with the precise timing needed for ejaculation. The pleasure signal still reaches the brain, but the muscle coordination needed for fluid release becomes inconsistent. This is why ignoring the issue is not the right move. Dry ejaculation itself is not always dangerous, but it can be a sign that something else deserves attention. It may point to medication effects, nerve health, inflammation, or prostate-related changes that are manageable when addressed early. Here is the most important takeaway. Feeling pleasure without fluid does not mean you are broken. It does not mean intimacy is over, and it does not mean you should panic, but it does mean you should pay attention. Your body is asking for awareness, not fear. If this change is new, persistent, or accompanied by pain, blood, or urinary changes, it deserves proper evaluation. Many men delay speaking up because of embarrassment, and that delay often causes more stress than the condition itself ever would. Aging does not mean surrendering vitality. It means adapting with intelligence. When you understand what's happening inside your body, shame disappears and confidence returns. You are not alone in this, and you are not the exception. If this information helped clarify something you've been quietly worrying about, let that matter. Share your thoughts in the comments, or simply acknowledge to yourself that understanding is the first step forward. Knowledge restores dignity, and dignity is something every man deserves at every stage of life. A third major factor that must be considered is hormonal fuel, specifically testosterone. Testosterone is not just about desire or muscle. It is the primary energy source for the male reproductive system. It supports sperm production, yes, but it also plays a critical role in how well the prostate and seminal vesicles function. These structures are responsible for producing most of the fluid released during ejaculation. When testosterone drops too low, the entire system slows down. At first, the change may be subtle. You might notice reduced volume or weaker force. Over time, the effects tend to stack. Desire may fade. Erections may feel less firm or less reliable. Sensation during climax may feel muted. Outside the bedroom, men often notice persistent fatigue, low motivation, mood changes, increased body fat, or loss of muscle. These are not random changes. They are signals that the body's hormonal engine is running below capacity. This condition is often referred to as testosterone deficiency, and it is far more common than most men realize. The important point is this: it is treatable. A simple blood test can confirm whether hormone levels are truly low. When addressed correctly and responsibly, restoring healthy hormone balance can improve fluid production, energy, confidence, mood, and overall quality of life. It is a mistake to automatically blame age and accept decline without investigation. While most causes of dry ejaculation are manageable, there are situations that should never be ignored. A sudden onset without explanation deserves prompt attention. The same is true if the change is accompanied by pain, burning, blood in urine or fluid, fever, numbness, or loss of sensation. These are not symptoms to wait out. They are warning signs that something deeper may be affecting nerves, blood flow, or internal structures. Certain neurological conditions, long-standing uncontrolled metabolic disease, or rare but serious urological issues can interfere with the delicate coordination required for ejaculation. Catching these early makes an enormous difference. Ignoring them out of embarrassment only increases risk and anxiety. Beyond the physical mechanics, there is an emotional side that deserves equal attention. Many men subconsciously tie the presence of fluid to identity, performance, and worth. When it disappears, doubt creeps in. Confidence drops. Some men begin avoiding intimacy altogether, not because desire is gone, but because fear has taken its place. This emotional burden is real, but it is also unnecessary. The presence or absence of fluid does not define masculinity. Pleasure, connection, erection quality, and intimacy do not vanish simply because one mechanical aspect has changed. Understanding what is happening biologically lifts an enormous weight and restores control. So here is a clear, supportive action plan. First, do not ignore persistent changes. Investigate them. A gradual or sudden shift deserves evaluation, even if it feels awkward to talk about. Clarity replaces fear. Second, manage the foundations. Keep blood sugar, blood pressure, and cholesterol under control. These directly affect nerve and vascular health, which are essential for sexual function. Third, break the silence. Talk openly with your partner. Talk honestly with a professional. Conversation opens the door to solutions. The absence of ejaculation is not the end of intimacy, and it is not a verdict on lost vitality. It is a signal. Signals are meant to guide, not shame. Whether the cause is mechanical, obstructive, or hormonal, understanding it is the first step toward peace of mind and improvement. Many men regain confidence, comfort, and enjoyment once they understand the cause and take action. Vitality is not measured in volume. It is measured in health, clarity, confidence, and connection. Do not let doubt or embarrassment delay answers that can dramatically improve your quality of life. If this message helped you understand something you've been quietly worried about, consider sharing it with someone who may need it. This information can genuinely change how a man views his body and his future. Support the channel so these conversations reach more men who need them. Your best years are not behind you. With awareness and action, they may still be ahead. Stay informed, stay confident, and take care of yourself.